everyone. Thank you for your patience with our technical details, and thank you all for joining us today. I'm here today to share details on my plan for reopening Oregon and the safety measures we're putting in place to help Oregon continue to move forward through this pandemic. Joining me is Pat Allen, Director of the Oregon Health Authority, and Dr. Renee Edwards from Oregon Health and Sciences University. She serves on my medical advisory panel. Also, Dr. Dean Seidlinger, our state epidemiologist, has joined us today as well. It's just been over 2 months since Oregon reported our first case of COVID-19. Since that first case, we've literally joined the world in facing this historic pandemic head on. We've taken extraordinary measures to protect our communities as we fought this virus, shuttering parts of our economy in an effort to save lives. Today, thanks to millions of Oregonians following the strict physical distancing measures I put in place, I am happy to say that these sacrifices have prevented as many as 70,000 COVID-19 infections and 1,500 hospitalizations in Oregon. We are on track in meeting the goals that doctors and public health experts have laid out for us. And that means we now have the opportunity to begin rebuilding a safe and strong Oregon. We have stabilized COVID-19 hospitalizations statewide, and in fact, we hit a record low this past week with fewer than 100 coronavirus hospitalizations across the state. We are increasing and enhancing supply chains for personal protective equipment. We still don't have everything we need, but things are definitely improving. We have finalized our statewide testing and contact tracing strategy. We've been ramping up those programs rapidly so that we can safely and quickly track, trace, and isolate new cases. From the very onset of this crisis, I've said that data and science would inform my decisions, and science and data remain my guideposts as we begin the reopening of Oregon. But let me be very clear. These choices are not easy. As we reopen parts of our economy, we know and expect that there may be an uptick in new coronavirus cases. That's why we have to be prepared in every single corner of the state, because as we've seen, an outbreak can occur anywhere in the state. Reopening any part of our state also comes with risk. This virus is still very dangerous, and it still poses a great threat. Until there is a vaccine, unfortunately, we will not be able to go back to life as we knew it. Not here in Oregon, or frankly anywhere. I know this can be a really tough reality to face. However, I'm inspired by the ways Oregonians have taken on a shared responsibility to protect each other through this crisis. It is really a testament to our generosity and compassion that we are where we are. These measures, combined with the talents of our extraordinary doctors, nurses, and health professionals, have made Oregon a comparatively safe harbor during this pandemic. I do have to be clear with each and every one of you. Physical distancing is and will remain a part of our lives for many months to come. Face coverings are and will remain a part of our lives for many months to come. Hand washing and good hygiene are and will remain life-saving daily practices. We must help protect our hardworking grocery store clerks by wearing our face coverings. We must continue to use video conferencing or telephone calls to connect with our grandparents and our elderly friends and neighbors. We must continue to connect with our friends and family, even as we remain apart. By continuing to limit our physical interactions overall, and with science as our guide, today I'm announcing the first details for the first phase of a step-by-step reopening of the state of Oregon. This framework takes into account the unique ways the virus has impacted different parts of Oregon. And here's what it looks like. First, we have established a detailed set of prerequisites that any county who wants to begin reopening must meet. These thresholds will help counties keep people safe as possible while we rebuild. They are also achievable. I've been briefing county commissioners across the state over the past week on details of these requirements, and the Oregon Health Authority is providing support in meeting them. For counties that meet the state's requirements to move into phase 1 of reopening, the following sectors are eligible to reopen following these specific safety guidelines. Restaurants and bars in these communities may open for sit-down service, but only with adequate physical distancing and the wearing of face coverings by employees. We encourage our customers, of course, to wear face coverings as well, but not while they're eating. Personal care businesses such as salons, barbers, shops, and gyms may open in a limited way. We will require physical distancing and increased sanitation, as well as a series of additional guidelines like wearing face coverings and gloves at salons. Salons must serve customers by appointment only and maintain records for contact tracing. Retail businesses can also open using physical distancing. We ask that they encourage this through proper signage, one-way flow in aisles, and using tape markings to delineate space. Local gatherings can increase in size to 25, again, with physical distancing. Some counties will be able to move into this phase before others. Once in phase 1, each county must remain for a minimum of 21 days so that we can monitor whether there's an unsafe uptick in the virus. If at that point, the county still meets the prerequisites and has not seen an increase in hospitalizations and emergency department admissions for COVID-like illness, then we will assess whether they are ready to move forward into the next phase. The details of phase 2 will be finalized shortly, but given what we know now, our expectations are to allow for somewhat larger gatherings and more work in office settings. There is some difficult news to share. Large gatherings, including live sporting events with audiences, concerts, festivals, and conventions, will not be able to return until we have a reliable treatment or prevention like a vaccine. The Oregon Health Authority is advising that any large gathering, at least through September, should either be canceled or significantly modified. I know this is really, really hard. I too will miss visiting our fairs and our festivals this year. Starting tomorrow, we'll begin accepting applications from counties looking to enter in phase 1. These applications will be reviewed quickly by the Oregon Health Authority with the goal of notifying counties that they meet the requirements that they are eligible to enter phase 1 as early as Friday, May 15th. In addition to this framework for phase 1 of reopening, I'm announcing strong recommendations on the use of face coverings and the additional lifting of certain statewide restrictions. Next week, we will be issuing guidelines related to the expansion of options for childcare and providing clear guidelines for summer school, summer camps, and summer youth programs. We have consulted extensively with doctors, nurses, and public health experts. They tell us that under the right restrictions, we can take this step safely. Health professionals will finalize details on the guidelines for childcare, summer school camps, and youth programs next week. I've prioritized opening these sectors because childcare is absolutely essential to allowing parents to get back to work and because education is the bedrock of our society. I want to close by saying that as this process of reopening begins, I again ask that Oregonians come together and be smart. Please follow the safety measures we are putting in place to help these businesses reopen. We've had the best doctors and public health experts guide us on how to safely and gradually reopen Oregon in a safe and strong way. It's up to all of us to follow their advice if we want to keep Oregon moving forward. Thank you, and with that, I'll turn it over to Dr. Renee Edwards.
Thank you, Governor Brown. Good morning, everyone. My name is Renee Edwards, and I'm the Chief Medical Officer of OHSU Health, and I'm a member of the Governor's Medical Advisory Panel. I want to reiterate a sincere thank you to Oregonians for helping flatten the curve of COVID-19. I stood in this same room on March 16th on behalf of Oregon CMOs with a stark message of COVID-19 potentially overwhelming our health systems. We asked Oregonians to please follow the governor's direction, and you did. Oregon has cut its anticipated infection rate by 70%, a truly remarkable accomplishment based upon what we have seen from so many other places around the world. And we've done this because of the governor's early, decisive response, along with the willingness of Oregonians to take action. The same modeling that in March predicted our COVID surge now clearly shows that it was these actions that prevented that surge. I know there have been extraordinary sacrifices made by Oregon's citizens, and for these, all healthcare providers are grateful. Now we must bring this same laser focus to safely and effectively reopening Oregon so we can all start to resume more normal lives while also continuing to manage any potential resurgent spread of COVID in our communities. I'm very appreciative that the governor has continued to take a scientific and evidence-based approach with her plan to reopen Oregon. The governor has established a very collaborative discussion with the Medical Advisory Panel. She's sought feedback from the group throughout the process and created a platform for sharing knowledge and exchanging ideas. The Medical Advisory Panel is comprised of healthcare professionals from across Oregon, along with OHA staff, and has helped to develop the strategies around pressing needs, identifying potential gaps and challenges, and we've given feedback from the front lines of Oregon's healthcare response. It's important to note that just as we have phased in measures to slow the spread of COVID-19, we will need to slowly phase them out. We need time between actions to understand just what the impact of lifting measures is having on the spread of the virus. That's why there's a minimum of 21 days between phases. So we can watch that impact and be sure that we do not see a rise in infections as a result. And even as we open some sectors, basic infection control measures such as hand washing, facial coverings, and physical distancing must remain in place to stay safe. I want to end by saying again what a meaningful difference every Oregonian has made for their community. I'm extremely proud to call this state my home. I hope we will all continue to act responsibly with our families, neighbors, and community in mind as we begin to enjoy some of these new opportunities. We're all in this together, and only by acting together will we be able to reopen Oregon safely. And now Pat Allen from the Oregon Health Authority will provide us with some additional information.
Thank you, Doctor. Again, I'm Patrick Allen, Director of the Oregon Health Authority. I'm happy to be here to be able to summarize the next steps toward reopening and the guidelines OHA's public health officials and the governor's office have developed to steer a safe reopening. These guidelines were developed with extensive input from business owners, county officials, medical experts, and many other people, and we really appreciate their input. Let me start by saying this. Keeping Oregon safe and strong depends on all of us. As Governor Brown noted, Oregonians prevented infections and saved lives by adhering to the governor's stay-home orders and the closure of schools and non-essential businesses. It worked. Oregon flattened the curve. So far, we have avoided the tragic worst-case scenarios we've seen play out around the world, regionally, and elsewhere in the United States. As of the end of April, Oregon's COVID-19 infection rate of 56.2 per 100,000 people ranked 4th lowest in the United States. Oregon's COVID-19 death rate was the 8th lowest in the country. Our hospitals have enough beds and ventilators to treat people with severe illness. As of yesterday, Oregon had more than 2,000 available hospital beds and 775 available ventilators. Now we're on the cusp of reopening, but that doesn't mean COVID-19 has gone away. It continues to lurk in our communities. It continues to threaten the lives of Oregonians, especially older adults. And it continues to put the health and well-being of people of color, people with lower incomes, and healthcare workers at disproportionate risk. We're not in the clear in our country or in our state. COVID-19 infections could spike quickly if we don't act responsibly, all of us. We can contain COVID-19 if we take careful steps toward a safe, phased-in reopening, continue to practice social distancing, and act responsibly toward others by following the guidance of public health experts. State and local health experts will do our part to protect Oregonians. We will expand testing and contact tracing. As Governor Brown described last week, we will work to keep the lid on COVID-19 infections by testing, tracing, and isolating new COVID cases and preventing the virus from spreading to others. Statewide, we intend to test more than 15,000 Oregonians a week. We're in the process of adding 600 contact tracers to support local contact tracing efforts. We'll review county reopening plans to ensure conditions on the ground in each locality are safe enough to support phase 1 of reopening. Let me talk for a minute about guidance documents. The public employers and key business sectors can do their part by following these guidelines for safe reopening. All these guidelines are based on best practices to reduce COVID-19 transmission. In addition to the retail, restaurant, and personal care business guidelines that Governor Brown discussed, we're also issuing guidelines for the general public. Under these guidelines, we'll continue to recommend Oregonians wear face coverings in public, keep 6 feet apart, and avoid unnecessary travel. We'll issue general guidelines for all employers. All employers have a responsibility to keep your employees and your customers safe. These guidelines will include things like implementing physical distancing and increasing physical space between workers, encouraging telework as much as possible, staggering shifts to minimize employee contact and limit employee gatherings, limiting non-essential travel, and more. We'll issue guidelines for outdoor recreation. Outdoor recreation agencies can give Oregonians the opportunity to safely enjoy the outdoors by prohibiting parties of 10 or more from congregating together, encouraging people to remain 6 feet apart while hiking, using boat ramps or beaches and other activities, keeping high-traffic day use areas such as playgrounds, picnic areas, pools, and basketball courts closed. Next week, we'll issue guidelines for public transit and, as the governor referenced, daycare facilities. All these guidelines can be found on OHA's COVID-19 webpage. We look forward to reviewing reopening applications from counties in conjunction with Governor Brown's office. Here are the 3 public health parameters the governor's office and OHA will look at in reviewing county requests to enter phase 1 of reopening. We must see fewer Oregonians getting sick with COVID-19. Hospitalizations within the healthcare region that encompasses the county must show a decline for 14 days. Across the state, emergency department visits for COVID-like illness must remain below the seasonal baseline for influenza-like illness. A county has to have resources to carefully investigate COVID-19 cases and isolate people who are sick or who have been in contact with people who are sick. This includes having 15 contact tracers per 100,000 people and an adequate ability to isolate people and quarantine people who may be contagious. The county has to be able to trace 95% of contacts within 24 hours. And it needs to be able to do this tracing and support of quarantine and isolation in languages residents speak and with cultural sensitivity necessary to build trust and ensure compliance. In addition to the county requirements, we have to have adequate testing in each healthcare region that wants to reopen. Healthcare providers must have the capacity to test 30 people per 10,000 per week, and underserved communities have to have access to testing since they are experiencing disproportionate rates of infection and illness. We have to have adequate healthcare capacity in the region where a county wants to reopen. And this means being able to having at least 20% of available hospital beds to absorb any potential surge in cases. And we have to have enough personal protective equipment in place to protect healthcare workers and other frontline personnel. To conclude, we are not returning to business as usual. We are venturing into uncharted territory, safely reopening businesses and other activities during a pandemic. We know there will be many questions. Each employer, retailer, restaurant owner, personal care provider will know best how your business operates. These guidelines tell you how you can operate safely. Follow them. Each county will have to demonstrate it has met the criteria for a safe, phased reopening. But a county must do more than meet the threshold to reopen. Counties will have to maintain safe conditions to stay open and move to the next phase. Each one of us will have to continue to practice safe hygiene, minimize travel, stay 6 feet apart, keep older loved ones safe by avoiding physical contact and taking all the other steps that we have successfully been taking that are necessary to protect each other and ourselves. Oregonians have a history of building safe and strong communities even in uncharted territory. We can do it again if we all work together. Thank you.
Thank you. Thank you, Director Allen. I think we're ready for questions.
Our first question will be from Lisa Balick from Hawaii. Go ahead, Lisa.
Yes, good morning. Governor, what do you say to people who will be allowed to go back to work, afraid for their safety, whether it's owners or employees, and what are the repercussions for them not going back when they're allowed to, but don't want to because of safety concerns?
My goal as governor is to make sure that Oregonians across the state are safe and healthy. And with the gradual reopening and the additional requirements, including testing, contact tracing, and isolation, we think we can continue to contain the virus. Behind all of these sector guidelines, we used data and health criteria to make these decisions. I don't know if Pat or Dr. Seidlinger wants to add anything.
I think that nailed it.
Thank you, Lisa. Our next question will be from Rachel Monahan with Willamette League. Go ahead, Rachel.
Hi, can you go over what requirements you're putting into place around mask wearing in public and in businesses? And my understanding from the announcement your office sent out in advance is that you're highly recommending it indoors. And I'm wondering why you all are wearing masks today.
Great question, Rachel. I'm not wearing a mask while I'm speaking because I believe that what I would be saying would be a bit muffled. As you can see, I wore my State of Oregon mask that one of my staff members' daughters made. And on the back, just to make sure that you know, it's a real made in Oregon mask. We have Doug furs, and there's a little, I think there's a big picture of Bigfoot on the mask. So we wore them all coming in, and I will wear them going out. But our recommendations for Oregonians in terms of wearing face coverings, we want to make sure that Oregonians are protecting themselves as well as their neighbors and their community members. So I'm asking Oregonians to be both kind and smart to protect themselves, but also to protect members of their families and folks that they come into contact with. We have certain requirements for certain businesses that those employees must wear masks. And for families or vulnerable community members, our team is building a website to help support access to PPE for both medical and business community members. And for vulnerable Oregonians, I'm continuing to call on our communities across the state. They've done great work in supporting our medical community. We've had folks who are sewing masks in cities around the state. If you're a sewer, now's a great time to help make more face coverings for vulnerable people in your communities. So we'd ask you put your great skills to work.
Thank you, Rachel. Our next question is from Lachey Wesley with K2. Go ahead, Lachey.
Governor Brown, do you have any idea of what counties could qualify to reopen on May 15th?
The question was, do we have any idea of what counties will qualify to reopen? And I'm going to turn it over to Oregon Health Authority. I think they have a list.
Yeah, again, Pat Allen with the Health Authority. As we look at the preliminary data, of course, we haven't received any actual applications. Oh, no. Oh, there we go. We've not received any applications, and a big piece of this will be the ability of individual counties to do this contact tracing, isolation, and quarantine work that we talked about. But if you look at the metrics level, I think it's safe to assume that the majority of Oregon counties will be in a place by next Friday that they meet those metrics to be able to successfully reopen.
Thanks, Lachey. We're going to try and go next to Ted Sickinger. Looks like his line is still on hold. So we'll go to Andrew Stelsky with the AP. Go ahead, Andrew.
Yes, hello, Governor, everybody. Governor, to what extent did you coordinate this with the governors of the other 4 western states that you're in a pact with? And then I'll just have one other question on another topic. I'll just squeeze it in here. What about businesses that violate your orders? How do you enforce them?
Okay, that's 2 questions, Andrew. In terms of our coordination with our Western PAC states, our chiefs of staff are talking on a regular basis, and our public health directors are as well. As a specific example, we opened, for example, fishing on the Columbia River in conjunction with the state of Washington, and we'll continue to coordinate with the state of Washington, in particular around parks and recreation. In terms of enforcement, what I have to say is this: people around the state and business owners have made tremendous sacrifices to comply with these physical distancing measures, and I know it's been really, really challenging. We're working hard to be able to get these businesses open safely and to be able to protect the public around the state. Obviously, there are a few outliers that are violating the stay-at-home and physical distancing order. These businesses need to understand that opening before we're ready literally puts lives at risk. And in a few rare cases, state agencies might be issuing fines and taking actions to shut down businesses if it becomes necessary. But for the most part, Oregonians have done an extraordinary job complying with the executive orders and these physical distancing measures, because we all understand that lives are at stake.
Thanks, Andrew. Next question will be from Courtney Vaughn with Hamlet Media. Go ahead, Courtney.
Hi, yeah, it seems that rural counties are on the list for those who might be able to reopen a little sooner. Is there a concern that people will sort of flood those areas and create an additional problem? Or are we thinking that both counties will be ready to reopen by next week?
Go ahead.
Great question. I think it's important to remind people that one of the recommendations and one of the things we call on Oregonians to do several times in what we've talked about today is to avoid unnecessary travel. The fact that things are open isn't an open invitation to travel 200 miles across the state and flood into a region, because that will backfire on all of us, on the communities that people visit, and on our ability to continue to gradually reopen things. And so we really are asking people as things reopen across the state to make use of those services and facilities and opportunities in your communities, but not to travel in other parts of the state, so that we can continue this slow, measured, careful reopening.
And you'll notice that from the recreational openings that there are still certain parts of the state that are closed to recreational activity. For example, the North Coast beaches and the Columbia Gorge. I think the goal is to do a gradual reopening, and again, we want to encourage Oregonians to be smart and make smart choices, and that means if you do end up traveling, to make sure that you have appropriate supplies with you, hand sanitizer, and that you pack it out and pack it back in.
Next question will be a written question from Dick Hughes. Dick Hughes asks, what is the status of looking at reopening of faith organizations under guidelines? Some churches are already reopening. And for reporters listening on the teleconference line, if you'd like to get to the question queue, please press 0. Thanks.
Dr. Seidlinger, do you want to take that one?
I think in working with our faith communities, we treat those gatherings as we do others. That we ask that as Oregon begins to open up, if a community, a county is ready to open up and has met the criteria, that gathering size would increase to 25. We appreciate them trying to maintain physical distancing, and if at all possible, they can maintain some of their activities where it doesn't involve people gathering, using the electronic means, the creative drive-in ceremonies, that would work as well, help protect their parishioners and help protect the members of the faith community. And again, they're the similar recommendations we make to other organizations about gatherings, that limit those physical gatherings when you can, keep the physical distance, and that way you can keep everyone safe in the community.
Our next question will be from Dirk Vanderhart with OPB. Go ahead, Dirk.
Thanks. A couple things for Director Allen. On some of the metrics. So the most recent testing rate data I saw was from April 24th, and only one of your health regions then met the criteria. It seems like now you're saying many of them, or the bulk of them, do. So curious about that. And also, there's a statewide requirement around emergency department visits, and that it can't go above a certain percentage. It's not been clear to me that, from the data we've seen, that we are currently meeting that, but it sounds like you think we are. And then just very generally, can you say that it is more rural counties that are qualifying or anticipated to qualify right now, and maybe not like the metro area? Sorry, I know that's a lot.
You got the record so far for 3 questions, I think, slipped in there. First, in terms of testing metrics, those metrics you quoted, I think, April 24th, those numbers have been, the actual tests administered have been increasing dramatically today. We received results for nearly 2,500 tests today alone. We've received 14,000 test results in the past 7 days, and those numbers continue to ramp up. One of the keys to being able to meet this metric, which is in fact based on capacity, not actual tests administered, is the fact that we finally got supply from the federal government for cartridges for the Abbott rapid test machines, and we've now been able to deploy those machines around the state, primarily to rural communities or clinics and others who serve underserved communities, and that gives us significant capacity, capacity to be able to do testing and testing in response to potential outbreaks. In terms of the COVID-like illness metric, our daily report includes a chart that shows the percentage of emergency department utilization that is related to COVID-like symptoms, and we saw that number build over time and peak at about the time that the pandemic peaked in Oregon before it settled back down to the plateau we're at now. Those numbers have come back down to that baseline level of a couple of percent of those visits, and so as we look at that, I am comfortable with that, and I have lost track of your third question, Dirk.
If I may, maybe
So my other question was, can you generally say that
rural,
it is,
yeah.
Rural counties that seem to qualify?
Yeah, I don't think
Or urban counties?
Yeah, I don't think I want to go quite that far, but I would say the more rural a county is, the subject to capacity to be able to do contact tracing and quarantine and isolation support, probably the more likely it is to be in a position to successfully apply. Doctor, you wanted to add?
Yes, this is Renee Edwards. I'd like to make a general comment, if I may, about emergency room visits. Not only are the percentage of COVID-like illnesses and influenza-like illnesses down, emergency room visits across hospitals in Oregon are significantly down everywhere for all conditions. And one of the things that I really want to emphasize to Oregonians is that seeking health care at this time is safe. Just as Oregon is reopening in many sectors, healthcare has been open throughout our pandemic response and will continue to be open. And I want all Oregonians to know that we want you to seek care for those health conditions that require care rather than not be in contact with your provider or be concerned that seeking health care could place your health at risk for contracting COVID. Know that it's safe. Know that we're there for you and that we are open and continue to treat all conditions for which Oregonians seek care.
Really important point. Thank you.
And I'll just add to what Director Allen said. Because that percentage of COVID-like illnesses presenting to the emergency department is so small, you can barely see it on the daily report. That number is below what we would see typically this time of year for influenza-like illness. That typical people presenting with respiratory illness and fever right now would be about 1.5%, and the folks presenting with symptoms of COVID are below that. And we've seen that really over the last several weeks since that peak, when the disease peaked here. So presentations into emergency departments can be an early indicator of increasing disease, and we're not seeing that. That number is staying below 1.5%.
Thanks, sir. We're going to try and go not to 10 signature again. To Les Seitz. Les, are you there?
Yep, I'm here. To our governor, a couple questions. On the large events, to be real clear, is it your expectation that the local rodeos and county fairs are going to have to be canceled? And what about the Oregon State Fair?
The answer is yes, but things could do, fairs and, for example, could do some of their events and do them differently with physical distancing and with more limited numbers of people. And I think that probably applies to the Oregon State Fair, as painful as it is. I know this is painful for everyone, particularly the Senate president, because he loves those goat milking contests. But I do think some of the pieces, some aspects of the fair could continue, again, with physical distancing, appropriate face coverings, and limiting the amount of people.
Could I ask one other question, Governor? Again, you're targeting large events for the fall. At this point, what can you tell parents about school for this fall?
We're still working on it, but school, our education system is the bedrock of our community, of our society, and it's critically important and a priority for me to get our students, our kids back into school in the fall. It will probably look a little different than it has, but Director Gill and the folks at the Department of Education are working with educators across the state, with parents, with superintendents and principals to make sure that we can do this in a way that's safe, that protects our students, but also protects our staff, and to ensure, most importantly, that our children get the stimulation and the education that they need through our public education system.
Thanks, Les.
Thank you.
Our next question is from Michael Russell with Oregonian. Go ahead, Michael.
Hi, Governor. It's Michael here. I've had some businesses ask me about the 10 p.m. curfew for bars and restaurants. Can you explain the reasoning behind that?
I absolutely can, but I'm going to let one of the physicians do that. Dr. Seidlinger.
I think in looking at reopening businesses and other institutions here in Oregon, we know that things aren't going to return to the way they were. We are putting things in place that can limit physical distancing, trying to keep 6 feet apart, using face coverings when appropriate. The curfew is an attempt that in some of these locations, as we open them up, a bar isn't going to look like a bar did before. We're asking people to sit down with their party and stay 6 feet from others. And we know that if those bars are open late into the night, oftentimes, if people lose track of how much they're drinking, they may not keep their physical distance as much. So as we slowly and carefully reopen, we want to put that piece in place so that people can take responsibility for their actions. And as we see what's happening in Oregon, we'll re-examine all the requirements on businesses, but it's really an attempt to try and make sure that we can let people go out, enjoy a visit to a bar, enjoy a visit to a restaurant, but not open it up like it was before this pandemic arrived, and we'll continue to reevaluate those criteria.
Thanks, Michael. Our next question is from Jess Burns with OPD. Go ahead, Jess.
Hi, yeah, thanks. The 600 additional contact tracers Joe mentioned coming online, I am curious if that is the number that will satisfy the initial benchmarks for reopening counties statewide, and what are the challenges y'all are facing bringing those workers online?
Director Allen, take that one.
Thank you. So we've identified the first 100 of those already by identifying Oregon Health Authority employees and moving them into slots to be able to do that contact tracing work primarily as surge capacity and backup capacity, especially thinking about how to meet the needs of rural and frontier counties that have relatively little infrastructure themselves. The remaining 500 will be added not by the state but at the local level, and that will be a mix that will vary from county to county of county employees potentially community health workers, people who work for community organizations that have deep relationships with at-risk communities, those kinds of things. There are already today, before we even start any of that work, about 250 people at the local level doing contact tracing work. That's an increase from the 70 or 80 that usually do that full time, because this is a core public health function that exists even in the absence of COVID. So between all those sources of contact tracers, yes, we're confident that that number of people will allow us to meet the threshold. That said, we're also not wedded to that's absolutely the maximum number, and that it might not need to go up. The good thing about this is once we have this infrastructure in place, the number of people is pretty scalable pretty quickly. And so if we determine that we in fact need more people, we can rapidly add and train and support more people to do this work.
Great. Thanks, Jess. The next question is coming in writing. And we've been asked, there's a bit of an audio issue, so the presenters can repeat the question briefly. The next question from Lynn Terry is about face masks. She's asking, where will they be required and who will police these requirements? And why isn't the public being required to wear them in shops and boutiques?
Thank you. In terms of face masks, I'm asking Oregonians to be considerate of others and wear a face covering. We obviously know that not everyone has access, and so we want to support and continue the volunteer efforts that are happening across the state. If you are a volunteer that wants to make and donate non-certified PPE, we'd love to have the information about you to put on our PPE resources website. And in terms of specifics, the question was, why aren't we requiring it? Because we're asking Oregonians to be thoughtful and considerate of their neighbors.
And the next question we have is from Blair Steinbeck with Portland Mercury. Go ahead, Blair.
Hi, correct me if I'm wrong, but it doesn't look like you're asking businesses to require temperature checks for customers coming into retailers or restaurants. I'm wondering if you could talk about why that isn't part of the reopen strategy.
Yes, thank you for that question. Repeating the question, why isn't the temperature checks a part of reopening strategy? We know that temperature checks upon arrival to work can serve an important piece of people returning to work safely in healthcare settings, some other long-term care settings, and some other specified settings. But on a grand scale, what we're asking is that people who are sick, who have symptoms, who aren't feeling well, that they stay home until they recover. For individuals walking into a store, whether it's a grocery store or a boutique or another institution, we ask, again, as you heard Governor Brown say, that they use a face covering when they go in. We don't think that checking their temperature upon arrival to a store is significantly going to cut down on the spread of disease. So we really just ask people who are sick to stay home, to cover their faces when they're going into these settings, and that's going to offer Oregonians themselves, the people around them, the best protection.
In addition, not everyone who has COVID actually has a fever. As far as symptoms reported, it's roughly 50% of people with COVID actually have a fever. And I think an important piece here is recognizing it's not just one thing or another thing that keeps us safe. It's the full complement of understanding the spectrum of disease as far as symptom checking, wearing facial coverings, physical distancing. So sometimes if we say we require one thing, it stands out as being that measure that protects us, when in truth it's the full complement that helps us all feel safe.
Thanks, Blair. The next question we have is a written question from Pat Doris with KGW. Pat asks, is the governor ordering or suggesting concerts and other large gatherings be canceled at the end of September or suggesting? And can high school and college football teams compete without fans?
In terms of large gatherings, I wanted to give Oregonians a sense of what the future holds in terms of large gatherings. And so at this point in time, it's a recommendation. We haven't formally made that decision yet. The second question is football and what was the other sport?
High school and college football.
High school and college football.
I think, thank you, Governor Brown. Let's go on college football. I think, we're continuing to examine the types of activities that can take place. Non-contact sports, things like golf or tennis where people can maintain a distance are probably some of the things we're going to see coming back first. For some of these other sports, basketball, football, and other things where there is more close contact, obviously there is more risk. So I think as we approach football season, we can see how the disease is behaving in our community, what kind of steps could be taken around the team themselves and the people, the coaches and others around the team to see if they can safely start. But as you heard from the governor's remarks, large gatherings will likely not be happening through the end of September. So if those activities, or when those activities resume, they would likely resume without the fans in the stands, but hopefully the fans watching them from a screen in the safety of their own home.
And next up, we have a follow-up question from Rachel Monahan from the Lyman League. Go ahead, Rachel.
So adequate PPE has been part of the criteria for getting, hospitals up and going again as of May 1st and as part of this plan. So a two-part question. Can you explain why hospitals were allowed to reopen, non-critical care without having adequate PPE for nurses to change masks for every patient, that standard that we used to have 2 months ago, and what the standard is for adequate PPE for reopening campuses? Are we still using a pandemic standard? Are we going back to one patient, one mask?
Director
I'll go
Allen.
ahead and take a shot at that, and then others can add or correct. I think first, the really important thing to know is that when we think about whatever phrase you want to use, elective procedures, non-critical care, those kinds of things, we're talking about things like cancer surgery. We're talking about really important medical procedures that we can't just put off for the duration and not resume. And so this is, back to Dr. Edwards' point, this is important health care that people need to be able to access. There are different levels of use of personal protective equipment. And so we are allowing these procedures to occur when hospitals are taking steps to conserve personal protective equipment, but not if they're in crisis care mode in terms of use of PPE. So sort of a middle step. We think that's a prudent balancing of the different interests of being able to do these important medical procedures while protecting patients and staff from infection. In terms of reopening, the standard using that conservation level of PPE is a 30-day supply of PPE for large and urban hospitals and a 14-day supply for smaller and rural hospitals.
Dr. Edwards, you want anything?
I would just like to echo what Director Allen mentioned. As far as surgical procedures are concerned, there are emergent surgeries, there are urgent surgeries, and then there are what we call elective surgeries. But some elective surgeries are actually necessary surgery. And again, the very appropriate reference would be to a cancer surgery. Often a surgical treatment for cancer doesn't have to be done emergently or even urgently, but it is necessary and needs to be scheduled and handled for best delivery of patient care. Within the guidelines that were released, it recognizes that Oregonians do have ongoing health needs even during the course of a pandemic, and it's appropriate to address those such that patients' health conditions don't reach a point such that it's significantly impacting our ability to treat and cure patients of those diseases. The PPE component is very important, but I want to ensure Oregonians that hospitals are following the standards required of the contingency measures within the PPE and monitoring our supply. Great, thank you.
Thanks, Rachel. We have time for just a couple more questions, so we're going to go next to David Jakes with the Roseburg Beacon. Go ahead, David.
Good morning. This question is for the governor. I have a question kind of following up on the non-essential medical and dental treatment. When are those going to be fully restored? We have a family member who just went through a dental crisis and had an infected tooth. They were denied, canceled their appointment 3 times, and then they went into full sepsis and were admitted to the emergency room in the hospital. So I'd like to know when that is going to be universally restored for all procedures, and especially at a time where we have up to a third of medical staff being laid off and furloughed because there's no volume of these medical centers. The second question has to do with contact tracing. Do you intend for that to be voluntary? And if not, those businesses and individuals who don't want their personal records circulated out there, who is doing business with them? How do you guarantee their Fourth Amendment right to privacy?
Thank you. I appreciate the question about dental care, and I'm very sorry to learn of the family member that has had this, what I would consider an emergency dental situation. We reopened hospitals, medical clinics, dental offices as of May 1st. Obviously, the communities, they needed to have adequate personal protective equipment. The reason we made that decision is because to close down these facilities is because we were concerned about having adequate PPE for folks in the COVID crisis situation. So given that supplies are substantially better, I made the decision to open all of these clinics as of May 1st. So the Director Allen can certainly respond to more details, but I'm terribly sorry to hear about this person's medical dental situation. Oregonians deserve access to health care.
Yeah, just two quick things. We've also reopened access to veterinary services, but dentistry in particular generates aerosol in its procedures frequently, and so access to N95 masks and other aerosol protection is really important and is a challenge. One of the things we've done is use some of our PPE state stockpile, working through the various associations to replenish those supplies, especially for places like dentists and veterinary offices who donated their PPE either to the state or to local hospitals when we were at the peak of the crisis. So dentists are having a little bit of a harder time getting reestablished, but we're working to try to facilitate that.
I forgot. What's the second question?
Contact tracing.
Contact tracing.
And is it voluntary?
Dr. Seidlinger, do you want to respond to that one?
I think, in public health, doing contact tracing, identify folks who may have been exposed to someone who's ill is part of what we do every day. The effort is stepping up in response to COVID-19, particularly as we know this can spread from people before they develop symptoms and who don't have symptoms. It spreads very quickly with close contact, so in households and some other occupational settings like our congregate care facilities, and we've seen in some of our food processing plants where it can spread fairly quickly. We've had great success in folks that we've been working with who have followed our public health advice from the state, from our local public health and tribal health authorities to stay home and isolate while they're ill until their symptoms resolve. For those folks who are exposed, to voluntarily stay home in what we call quarantine for 2 weeks after their last exposure. We are working to make sure that we set up systems that the services they need, access to food, laundry services, delivery of medications or prescriptions that they need, that we can bring those to people where they are so they don't need to leave for those. And people have been voluntarily cooperating. Public health does have the authority to use kind of non-voluntary means, and we haven't had to do that throughout this pandemic, and we hope we won't because people have been collaborating. So, for those out there who do develop symptoms, we hope that they will, partner with our local public health authorities, and that's why we want to make sure we have people from the community who can speak the language and relate to the people that they're working with to explain the importance that the steps they're taking are keeping themselves and their families safe, and have that same conversation with folks who may have been exposed, so we don't have to use any additional means to keep people home and keep people safe.
Thank you, David. We've got time for one last written question. Brad Schmidt from the Oregonian asks, what level of concern, if any, do you have that counties or regions that reopen in phase 1 will see rises in infections or hospitalizations, triggering the needs to move back into mitigation measures such as reinstituting stay-at-home orders?
Director Allen.
Absolutely, I'm concerned. None of us want to be in a place where we're flipping back and forth between being open and being closed. But we are. This is not without risk, and we do expect that there will be more cases as we have more contact in society. The point of all of these different things, reminding people about the simple stuff like washing your hands and covering your cough or sneeze, wearing facial coverings, doing contact tracing, testing. These are all things that we layer on top of what we're doing to make up for the fact that we're going to allow a lot more contact across the region. And so that's why this process involves these 21-day steps to see what's going on and make sure we don't have a rebound in the disease, so that we don't go too fast and open things up too quickly and end up in a situation that gets away from us. But I'm very concerned. This is a calculated, mitigated risk, but a risk nevertheless.
And Brad, I'll just add, I think the ice skating metaphor is very apropos to your question about is there a risk? And that is, as a kid, I spent a lot of time skating on the ponds in Minnesota when the ice froze. And every winter we'd go out, we'd take a step on the ice, see if it was still safe, if it didn't crack, if it didn't start making noises. If it did, we'd take another step. That's why we are doing a gradual reopen of Oregon. That's why we're doing a 21-day time frame in terms of each phase, so we can test and monitor each phase. But you know, the bottom line is this is up to Oregonians. We're all in this together. Your actions impact others, and I am asking you to be, like you always are, thoughtful and considerate of your neighbors and your community members, and be safe out there. So, thank you.